Thanks so much for joining us, everyone. I'm just giving it a couple seconds for people to get into the room, and I'll start with introductions in just a couple seconds. Thanks so much, everyone, for joining us on this session from the Ogden Police Department, talking about their Homeless Services Advocacy Program. We are being joined today by Anna Davidson and Nancy Griggs, who are both homeless services advocates for the Ogden Police Department. They both use she, her pronouns, and we are going to be taking questions through the Q&A feature at the bottom of the webinar. So if you do have questions, please put them there. We'll do a Q&A session, a brief one in the middle, and then one at the end as well. But I will let Anna and Nancy share a little bit more about their experience, and looking forward to hearing their presentation.
Good morning, you guys. We're going to start off again. This is the Homeless Services Advocacy Program for Ogden City Police Department. I'm Anna Davidson, and this is Nancy Griggs. And we do have our captain off to the side to answer any questions coming later. I'm going to start with a video on the next screen, and then we're going to go into it after we watch this quick video. Hi, I'm Anna Davidson. I'm the Homeless Services Advocate for Ogden City Police Department. So right now we're 1 year ahead from where my program started with Ogden Police Department. So September is 1 year that I've been doing it full time.
We started the Homeless Service Advocate position as a pilot program. We weren't sure how that was going to work out and how that would integrate with law enforcement and our current police department functions in the city. We found that the program and that position were wildly successful. We bridged communication gaps with the homeless community and built partnerships in the community.
It's very difficult, I think, for the Ogden Police to tell the story of what they are doing in their community policing program. And I felt like the Homeless Services Advocate, just you alone, tells the story of, I think, what the agency is trying to do as a whole.
We realized immediately that the need in the community was more than just one advocate position. So the expansion to 2 advocacy positions is needed in the community, and it definitely helps our officers mitigate some of the calls for service or repeated calls for service that we go on.
I think working with the police has been amazing, and having an advocate with the police on the street has just completely changed the way homelessness is looked at in our community. I think that having a social worker hand in hand with a police officer that helps assist and guide those clients to services and handholds a lot of these clients that need that is phenomenal. I don't know what your stats say, but I could assume that it is decreasing police engagement because they have you to engage with these folks, and they can spend time doing other things in the community. And then I would also say 1 year later, I think from the macro level perspective, you're able to be on the street and actually show what the data, tell us what the data is telling us, right? And what is actually happening in the community, and who really is being impacted, and what folks are staying on the streets, and who are law enforcement engaging with, and the new folks that show up. Who are they? What are they in Ogden for, right?
What all those little barriers that happen along the way, I just said, I know you're homeless, but I can't prove it. Right. The fact that you guys see them and you have a case note about them, I can use that. And I can say, yes, you guys can verify that you know them to be homeless from this time to this time. I can just take a nice little letter and check that box and move on with them.
I think it's come a long way as far as building some trust with the community and with people who are currently experiencing homelessness. Typically have not the best relationship with law enforcement. And so I think that it's gone a long way to kind of put a face and someone who cares.
Having this advocacy program and the team approach with Ogden City Police Department has greatly improved our relationships with other community partners and developed that relationship.
Definitely the community as a whole perspective on policing has changed.
I mean, you have an understanding that we have to do our job sometimes, but then we also have an understanding to work with the people that are trying to better themselves and give them some more chances so that they can continue to get their housing or whatever resources they need.
We're redefining what those relationships can look like. It's not I'm more powerful, right? Or I'm the person who's going to tell you what to do. I think that the way things are happening in Weber County, what I'm so excited about is, especially with your position, is you're redefining what that relationship can look like.
Law enforcement hasn't always had a perfect relationship with the homeless community. With this program, we've built bridges, developed better communication between the police officers, the advocate services, and the homeless community.
It's just been a surreal experience to know that in 1 year's time, we've been able to create so much change, and how Weber County service industry and homeless and law enforcement are all working hand in hand together. We have removed so many barriers. We have built so many relationships. We have built so much trust in populations of people across the board that there was no trust before. And that comes from one person taking a chance on one person. It comes from individuals believing in individuals, and that's exactly what I do. I believe in individuals. So it came from someone in the administration, in the chief, in believing in me as this restaurant owner at the time, and this plan that I had. And here we are a year later, and we're housing people that have been homeless or unsheltered for 20 plus years.
I think every city should have somebody like this person. She's vigilant, she gets out there. She's not only vigilant, but she comes from a place of a heart. There's no judgment that follows her. I've noticed the law enforcement that works with her has learned a new compassionate and sympathetic way to work with us community members. This is the best team I've ever seen in my life. They are the most sympathetic, caring individuals that I've met. And I mean, the more communication you have with individuals on the streets, the less crime you're gonna have.
We have created pathways to help people and to problem solve and to do it in a very human way.
We've seen success from this program, and we'd like to continue that success and expand that success.
Here in Ogden, yeah, it's just phenomenal. And surprisingly, across the state, it's just not as good as it is here in Ogden and Weber County. It's very impressive. Of course, moving forward, it's just naturally going to grow. It's a good thing. And so when you pick a right plan, it just naturally grows and fills in the gaps, don't you think?
We're helping them believe in themselves. What's better than that?
It's a paradigm shift. It absolutely is. We are combining two very large systems that have not always worked together, that are now working together and taking approaches that are needed to benefit human beings.
It needs some love, and I guess that's what we're supposed to learn how to do, is love something.
And I'm really proud of him. I'm proud of his progress, and I'm excited to see how many more people like Taz we can help.
If I could do this, most anybody could do this.
As far as Ogden Police and as far as the city and everybody that has helped me with the housing and with getting my housing, I cannot say enough. I'm just so happy. And it's been so easy, and I feel like everybody should try to do it. It's a way of getting off the street, and the possibilities are so there. People shouldn't get discouraged.
I've seen the relationship between the clients that are camping out, staying on the streets, not as quick to hide or run now when they see officers coming, which is a big change, and it's a good change. And I've seen officers actually go and hand out, a cup of coffee instead of trying to, hey, get out of here, it's time to go. They're actually working with them. So that is such an incredible change that I've seen within the community with officers.
We all kind of work as a team, which I love. you know that you can call Anna anytime, or you know that you can call somebody from a different agency, and we have this cohesion, and it's really beautiful, actually.
It feels like, you know, obviously in patrol we're doing calls of service, which is great, but it feels like here we can reach bigger problems and kind of, you know, really dive into certain issues that people are struggling with and work with them to better the community as a whole. And I think that has shown by people coming up to us and talking with us, you know, more than just a normal patrol officer.
We're doing really good things, and it's because of Ogden City, the administration, and the police department, and everyone, from the chief to the deputy chief to the sergeants, the lieutenants, the patrol, traffic, strike force, crime reduction, community policing. I would not be where I am right now in building this program if the community policing officers hadn't given me a chance. I'm so grateful. I can't wait to see where this goes as we continue on. I hope that we can get buy-in across the state to have every police department and every social service network across the state working hand in hand.
With the success of the program, we see a need for expansion. Where are we going to go in the future? What we're looking for is developing an additional homeless service advocate position, overlapping those positions and creating a coverage for advocacy for 7 days a week. We've seen success from this program, and we'd like to continue that success and expand that success.
Okay, so that video just gives a brief overview of 1 year later. And as you guys can see, the involvement and engagement between service providers and the homeless population and law enforcement is crucial in making this work. I wanted to start a little bit about, this is where we began. This drawing came from me as a restaurant owner here in Ogden when I went to the city administration and the police department and said, listen, I see some gaps. I see how we could do things a little differently. I can see what I have this vision. And they said, okay, let's take that vision and see what we can do through the police department. So this is just kind of a rough drawing of what I started with and what the police department started with in building this program. And it just kind of shows you the navigation of the nonprofits and the government agencies and our vulnerable at-risk homeless population and the people that are on the streets, and how overwhelming the system can be for them to try and navigate on their own. And so that's where we step in. This is a little bit of myself and Nancy's experience. I'm a Utah State U graduate. I have a bachelor's in social work, and I'm getting ready to work on my master's. I was a 20-year business owner in the Weber County community, and I was known for hiring people that other individuals didn't want to give a chance to. So I've had a lot of experience. I've worked in juvenile justice. I've worked in inpatient treatment facilities for youth. I worked on substance use with women. I have a ton of experience. I'm going to let Nancy give a little bit of her background as well. Nancy is just 3 weeks here at Ogden Police Department as the second homeless advocate, and I'm really excited about where we're going to go from here. So I'll let Nancy talk to you a little bit.
Hi, I'm Nancy Griggs. I have worked the past 5 years in the mental health field. I've had years of case management service as far as with housing, mental health court, MCOT. I also am a certified peer support. I also have lived experience with substance abuse, domestic violence, and homelessness. There was right before I had my last child, I actually was homeless, sleeping in the park on 30th and Monroe in Ogden. So that's really what drives me the most, and being passionate about this kind of work. I've studied social work with Kaplan University, and I do intend to go back and finish my bachelor's.
All right, here we go. Okay, why are we doing this? We're doing this to educate our community by creating a basic understanding of mental health, addiction, and homelessness so that we can start changing the narrative. We all know that there's been a preconceived notion on homelessness and mental health and addiction issues for many years. And so we're hoping to, by seeing the individuals, that we can start changing that narrative and really making a difference in our community. So we have teamed up with a lot of the service networks here. We have great relationships with Lantern House, with Youth Futures, with Ogden Housing, Weaver Housing, Hope Clinic, Seeger Clinic. So we have a great network. We work really with Jennifer Eves from the VA. She helps us a ton up here. And the reason we're doing this is to help navigate the system for these people that can't navigate it on their own. Ultimately, this reduces the cost to the community and it reduces recidivism. Most importantly, we're doing it because it's the right thing to do. So these are the goals and objectives that we do through this position. It's to engage the homeless population in a manner to aid the goals and objectives of the police department, city of Ogden, which is to reduce the vagrancy issues, get people off the streets, reduce recidivism, which in turn does not cost the city as much money. So to save across the board and to help people, it's a cohesive path. We're part of the LHC. We go to all those meetings. We communicate with everyone on there. The homeless response unit, we're working on that with Captain Scott. And what that is we want to create an integrated team. And we're actually working with Melissa Freegang from the Center of Excellence on this as well, so that we can have a team ready to go that's medical, mental health, homeless services all together. So when we go to an encampment or we have someone that needs that wraparound service, we have a team that we can deploy out to help that person. So that's one of the tasks that Captain Scott and I have been trying to figure out how to bring that all together so that we have that readily available to help these people. In developing this program, we want to be able to meet the client where they're at and determine the best first steps and then create a success plan with them. Sometimes the first step is a hot meal or medical. It depends on that individual. And then Nancy has created a plan, a goals plan, and I'm going to let her talk a little bit about that. So that helps us push the success for the person.
So a lot of the times when we're meeting with clients and we want to discuss where you want to go, a lot of the times we can just talk about, okay, well, you need housing and you need food stamps and you need Medicaid, but really, like, how do we turn this into an actual game plan? What we're trying to do is we're trying to give them tasks every time that we meet with our clients throughout the week, and just, okay, this week, let's work on this. Or these are your 3 tasks that I'd like you to complete until I meet you next week. But if we just have like an action plan written down, what goals we have, you know, how long do we think we can take it to complete these goals, and what are we going to do? What are we going to do to help you help yourself, pretty much? This also helps keep the clients accountable for everything that they're doing. And it helps us to meet them where they're at, pretty much where they're at in their life and what's the most important to them.
We try to use positive reinforcement as well and give them accolades when they do complete tasks, why we're giving them another one so that they can see that there's a benefit moving forward. So we work directly in community policing. So we're always with the police officer. We both have an officer assigned to us, and that's our homelessness officer that works with us in the field every day. And again, this all comes down to reducing recidivism in the community and helping the people navigate the system. This is what we do. We evaluate the individual needs, housing, medical, mental health. We try to problem solve the barriers, driver's license, social security card, medical, their human needs. We work, like Weber County Sheriff's Office helps us with figuring out clothing, food, shoes are a big deal. Actually, Captain Scott bought someone a pair of shoes yesterday that came to the police department with no shoes and needed our assistance, and he jumped right in and went and got him some shoes, which I thought was amazing. So we help try and point them in the direction to take care of their legal issues. And this is something else that we have done. We've created a program with the Justice Court where we can actually go to court with the clients that have those low-level offenses, and we can talk to the judge about them doing community service with us, which entails doing these goals sheets and other activities and tasks, and we can count that towards their community service, which actually betters them and helps solve the problem, because we all know that legal issues are a barrier when it goes to getting them housed. So we've tried to create a program for that as well. We have also done and implemented training across the board with Ogden City employees, and myself and Officer Legwood did an entire presentation for every city employee. And we talked to them about mental health and homelessness and addiction and all of the things that go into that so that we could make this a very human. This is our model for success. These are all the agencies that we work with on pretty much daily. If we didn't have the support of all the people on this screen, we wouldn't be able to make this program possible. And this is just kind of another outline of these folks. And so we're going to stop right here, and I just want to check in and see if anybody has any questions to this point.
So I don't have any direct questions, but the Weber Housing Authority says, could we love you more? I will answer that question myself, ... And then there's a comment also from a Brooke Coster. It says, not a question, but I just want to thank you. We can all learn from you.
Thank you. We'll move on. This slide is about law enforcement, and we all know that they have the tools and the training and the ability to handle those difficult situations. And so we always want to rely on that relationship with our law enforcement and give them, they have the experience to do the things that we don't have the experience to do. The CIT training that's listed on here, I don't know if anyone knows about that. It's crisis intervention training. It's a 40-hour course. It's amazing. I was able to go through it with law enforcement this last summer, and I learned a ton. I learned how my brain versus their brain. So their brain is immediately on safety and keeping the people safe, including myself. My brain was on how do I help the person and not my safety. So this training specifically gave me such insight into the different perspective of law enforcement versus myself. And I think that's really important. And these guys do training nonstop. So I really feel like we need to highlight the fact they do de-escalation training. The briefing training is the training that we put together to try and get all of the officers to understand the importance of meeting the homeless person where they're at and kind of understanding their story and seeing what we can do next with them. And it's been a great success. We also have the MCOT team up here that we utilize, which is our the crisis team through Weber Human Services, and they respond out on calls when we call them to work with us on the mental health component. It's really a great relationship, and accolades to Weber Human Services for everything they do for us through that MCOT team. Police department also obviously stays up on all the legislative updates, current laws, law changes, everything involved in that. So we really want to change the narrative, not only about mental health and homelessness, but also the narrative against law enforcement so that we can build that cohesive path, because we need to come to the middle and have everyone see that we can work in the gray and help each other understand where both sides are at. This is a field collection form that we created. This form, every officer that's in the department has one of these forms in their cars. And so when they have an engagement, they're able to contact the individual, gather information, and then pass these forms on to myself and Nancy so that we can follow up with the individual. This is obviously totally volunteer. So if the person doesn't want to do it, they don't have to. But this gives the law enforcement officer an introduction and a way to gather data and help the person help us. This is a success commitment. So I have an intake packet that I created with the help of Deja from Lantern House for our program here at the police department. And one of the things that I did was create this success commitment. Just one small thing about this commitment. One of the things I like is I will not let one small slip up convince me that I am worthless or a lost cause. I will respect myself by refusing to engage in verbal self-abuse, and I will find positive ways to comfort and support myself when I am having a hard time. I will not sacrifice my own needs to make other people happy or do for them what I should do for myself. When a conflict arises, I will negotiate to find a reasonable solution that allows me to do what's in my best interest for achieving success. Just some of these things, the first lady I had sign this success commitment with me. She signed it standing at the front of the patrol car while we were filling out all the paper with tears flowing down her face. It's been 4 months since I started working with her, and she was just recently housed. She'd been homeless for about 3 years at this time. And I'm still in constant contact with her because we all know that the work doesn't end when we get them into a house. We have to help them reintegrate and understand and learn how to do the next steps for themselves. But I had started working with her a year previously, and she didn't follow through. She kind of fell through the cracks. She just kind of fell away, and then she came back. And when we did this commitment, she just really dedicated to herself. So I feel like this is a really key piece in helping them help themselves. Anything to add? That was a lot.
I honestly think I do have to touch on this. Like, I agree, when people are housed, that's definitely when the most work starts. A lot of the times, a lot of our homeless population, they are institutionalized, or they're just been on the street for 4, 5, 20 years. And so a lot of the times when they get into housing, that's when they bring their friends over, and they're still in that homeless mindset. So what I really appreciate about, you know, this agency and what I've been, and I mean, I've already felt that way. That's when the real work begins, and just hammering down, okay, your house, now what are we going to do? What's the next success that you can have? And I think that's definitely crucial to this program.
Teaching them where they can get food and how to budget the money and how to pay their bills and how to still continue with all the people. So it's really an important piece. So before we move on, is there any more questions? Because now I'm going to go into a little bit different piece of this. I just want to make sure if there's any questions for my captain or anybody have anything yet, we're going to continue on.
We do have a couple questions. One is, have you attended church in the park on Sundays to make contact with that population?
I've only been to church in the park on a Sunday just one time, honestly. And there's a reason. My whole life is what I do. And so in persevering myself, I have to make sure that I take the time to do my own self-care, or I will not be good for anyone. So I do have 2 days of my week that I dedicate to just being me at home in my space with my husband. So that's the only reason I've only gone to church in the park once.
Thanks for that. And the second question is, have you seen any officers push back on these measures that you are trying to implement? What policies are being utilized to ensure officers are following these assessments?
I'm going to let my captain jump in with me on this one. You want to put over and we'll let Captain Scott come in. He's rolling in.
I'm in the background. I apologize. Hi, I'm Captain Tim Scott. So could you repeat the question one more time for me?
Yes, absolutely. The question is, have you seen any officers push back on the measures that you're trying to implement, and what policies are being utilized to ensure officers are following these assessments?
So initially, yes, there was some pushback about bringing in social service workers or homeless service advocates into the police department, because there was some communication or confusion about what is this homeless service advocate going to do. But in law enforcement, we've seen for decades upon decades that we can't police or incarcerate our way out of homelessness, and we can't social service our way out of criminal behavior. So there has to be, like Anna was saying, that gray area. When we encounter this population, which part of the population needs services or social services, and which part may be breaking the law or engaged in criminal behavior that may need some enforcement action. So the integration was a lot smoother, in my opinion, than I initially thought it would be. There was some initial question and some apprehension from the officers about what the role of the HSA was going to be, but that evaporated pretty quickly. I think within the first 6 months, they began realizing that the homeless service advocate was there to stop that repeated. So they would go out on calls for service, on trespassing calls, and it was the same individual. And so that officer was frustrated dealing with that same individual and in the same exact situation. When we engage the social service or homeless service advocate, we can get them out of that cycle of behavior where we're not going call for service, or law enforcement's not going on that same individual over and over and over again. So yes, and our policies and procedures were already in place when it comes to dealing with homeless and evidence and arrests. So our procedures are still the same. We didn't tweak our policies and procedures too much when it comes to the advocacy program.
I think it was a lot of education and understanding too. I think the more education we gave the officers, the more understanding we gave them, the less resistance. And there was resistance initially, but I don't have any resistance now. I mean, we have officers that have made referrals to us that have, like in the video, Debbie Hansen had an officer not made contact with her initially and taken the time to get all of her information, I would have never known about her. And because he took all that time and brought her to me, we were able to get her a voucher, and she's actively out looking for an apartment right now. So I think that engagement, and like Kirshner, who's in the video, He's new to community policing, and just spending that first couple of weeks in community policing with me and building the rapport with the homeless population has actually aided him in the communication with them. So I really feel like it's a win-win right now.
Law enforcement benefits in general from having an agile business model. So it's we can move quickly, make changes, make operational changes, administrative changes to integrate this type of program into law enforcement without significant effort. So we're fortunate in that, and right, it's integrated well.
Well, there's two of us now, so it's working.
So let's get back. Thank you, guys.
Any other questions on that? Are we good to move ahead, Kelly?
There are some more questions. Sorry about that. So the next question would be, would PD provide a free basic de-escalation training for nonprofit agencies? And who should they contact?
Let me get Captain Scott back over here again.
So the question is, would the law enforcement provide a de-escalation training to private?
To nonprofits.
Yes.
Nonprofits. So our de-escalation training or crisis intervention training, we can bring a nonprofit organization into that. A lot of it is focused on law enforcement, crisis intervention and de-escalation. So it's more attuned to that, in my opinion. But some of the training that Anna and Nancy have done for our civilian employees actually may have more of an overlap into the private sector. So so there is some training that we could adopt to the private sector. To answer your question.
Yes, thank you. We have a few more questions. I don't know if you guys would like to continue with your presentation or if you would like to continue.
Yeah, let's go through the presentation a little bit more, Lynn,
Okay.
and then let's hold them for the end. That way we can get through the presentation if you don't mind.
Great. Before you move on, I just want to make sure you guys know there are a few comments or a few questions in here just praising you guys and the work you're doing. We are dismissing them, but they have been really nice. Thanks.
Okay, so right here, this humanization of homelessness and mental health and addiction, this slide is very important to me, and I'll tell you for a few reasons. One of the driving forces of what I do is because of my husband, Ron, who is the middle person in this video. He had severe childhood trauma. He has dissociative identity disorder. He has PTSD, and he has former homelessness and substance abuse. He is, to me, the example of what you can go through in your life and become. He's a successful human being. He ran a business with me where we were able to help tons of people just by being ourselves. So this I put in here to get people to understand the faces of homelessness and what people look like that suffer from mental health and addiction. The two on the left are individuals that worked for me. One of them had childhood homelessness and she suffered from suicidal ideation and generalized anxiety disorder. The other one on the right, Shaylee, has bipolar disorder and suicidal ideation, and she struggled with that for many years until we were able to get her a good therapist. And now she's an activist on changing the stigma around mental health issues. She tells people quite frequently, it's not who I am, it's what I have. And we have to change that stigma as well. Mandy on the right is formerly homeless. She has schizophrenia and she has developmental disabilities. My husband and I actually took her in from homelessness through our restaurant when we were on 25th Street. Mandy's story is somewhat tragic. She had a payee that was stealing her funds, and that's how she ended up homeless, but she didn't have the cognitive ability to explain to someone what was going on, and she didn't understand why. So I really try to humanize what happens so that people can understand that we all have a story that we start with. And until we start seeing that individual story, we can't start making change. These are a lot of so my degree is in social work, and that's my passion. And my passion is understanding a lot of the disabilities that people have, those mental health disorders like schizophrenia and PTSD and bipolar disorder, dissociative disorders. My husband, myself, so I always tell people I personally am diagnosed with a few things. I have PTSD, I suffer from generalized anxiety disorder, and I have depression, chronic depression. I am a person that understands how it is to feel so dark that the best option would be to end your life, because that's what would happen in my mind at the time. It would make it best for my family. I felt like I was a burden, been through all those things and made it through the other side. And so I am a huge advocate of making sure we change the narrative around mental health. And this is one of the things that I really drive on when I work with the population out on the streets and understanding them. And this is something that I'm really going to hone in on in my master's program. So I like to talk about these and make sure that we understand this doesn't define the person. This is something just like diabetes or any other thing that we deal with. And in my mind, I often go back to, why is our mental health not as important as our physical health? We push doctors, but we don't push mental health. Our mental and our physical are tied together, and we need to change that narrative. This is bipolar disorder. This is also, these slides are also part of the slides that Captain Scott was talking about, the training that I do with the city employees. I go through all of these disorders and what it looks like and what happens and the onset. And I'm just so passionate, I could go on forever. So I apologize, but this is about bipolar disorder, the onset, the average age. This is a biological disorder. So medication is important, and getting people to change the stigma so that people will take their medications and understand that they have choices to figure out, that they don't have to suffer. We can help them, but we have to change that narrative. Nancy's over here quietly just smiling, so. This is Mandy. This is the one in the video. Like I say, she is schizophrenic. These are some of the symptoms, the ages and the onset and what people go through. In that CIT training that I was talking about, if you ever have the opportunity to do that, they put these headphones on you and you have to do activities and skills with these headphones on, telling you that you're a terrible person and you need to kill yourself and that you're worthless. And it's so profound. I mean, I did it for like 30 minutes and I was like, there is no possible way I could do this. And these people that are diagnosed with schizophrenia, they didn't wake up one day and be like, I want to be schizophrenic. No, it doesn't happen like that. This is a biological, this is a genetic, this is generational, passed down through our genes that people get this. And like Mandy, the top picture of it is Mandy when she was homeless. She's very vulnerable. She doesn't understand when people are taking advantage of her. She got into meth. People told her that would be a good thing to do on the streets. And this is Mandy after she'd been with my husband and I for 6 months. It's a huge, huge difference right there. So I'd like to show these so that we can actually get some insight into mental health. This is dissociative disorders. I talk often about these. Like I said, my husband has dissociative disorder. He also has the amnesia component of it. We have 9 identified components that he cycles through on any given day, depending on what stressor he has. This is 100% created from trauma. So each one of these components, they don't call them personalities anymore, they call them components. Each one of these components can be tied back to a specific trauma that happened because that component came to life, came to creation or fruition to save him in that moment of abuse. So he created an alternate to survive that horrific childhood abuse he went through. This is a very real thing, and it's hard to navigate. Loving someone with mental health issues, you're either all in or don't be there at all, because it is going to give you the ride of your life. And there are going to be days that you don't know if you can make it. And so this is a really important piece to cover. This is post-traumatic stress disorder. A lot of times people identify this just specifically to military, and that's not true. PTSD comes from traumatic events. A lot of people don't realize that. Probably, I would venture to say that every one of our police officers that have been on the force have PTSD. You cannot see the things that these guys see and not be affected by it. And so it's very real, guys. Like, this is a very real thing, and we need to talk about it. We need to understand the triggers and the components, and we need to work with people through these processes of these disorders that they have. You know, this is a very real thing. PTSD is huge. Fight or flight, broken fight or flight is like how I like to call it. There are 2 responses, and this is one of the things of learning mental health components is there's the fight where you come up swinging, or there's the flight where you take off. I mean, this is a really, Anyway, we're going to leave it at that. There are two types of PTSD. There's complex PTSD, and then there's just PTSD. You can tell the differences right here of more of what they go through when they have these symptoms. Me personally, I recluse. I go straight into myself. My husband, he comes up swinging. And now we're going to just jump into, these are the state of Utah annual homeless report on homelessness. These are 2020 numbers because 2021, we were not able to do the subpopulations. We didn't identify those due to the COVID restrictions, but this has stayed pretty consistent. Andy Beatles from Beaver Housing Authority helped me with this. So this is just, we want to talk about the number of people that are out on our streets and how many of them go through homelessness. I think this is really important. 10 out of every 10,000 people in the state were experiencing homelessness on the night of the pit count. These are mitigating factors from poverty to homelessness, the lack of employment opportunities, the wage gap, decline in affordable housing, lack of affordable health care, domestic violence, mental illness, addiction, and now we get to add COVID to that because COVID has changed the game. So 25% of homeless have a severe mental illness and 45% have just mental illness. So that means 25% all are diagnosed with 2 or more of those. So bipolar and depression, PTSD and anxiety. So that's a pretty big deal if you think about it. And then why are we doing it? We want to educate ourselves on homelessness, mental health, and addiction. When engaging our homeless population, talk to them like people because they are people and we all have a story. They all didn't get there just because they wanted to be lazy drug addicts. I love when we hear that. They're just lazy. They don't want to get a job. They're just drug addicts. It all roots back to that core. We need to look at the root cause. That's the one thing historically that we haven't done. Looking at the root cause and figuring out from that root cause, that first initial set of trauma through, how do we help that person all the way through? And then we like you, if you have assessed for visual needs, there's my contact and Nancy's contact on here. We do want to stress personal safety as priority. We never want someone to put themselves in a situation that endangers themselves or others. Do not do that. We know that people want to help, but we have law enforcement for a reason. This is where that comes in, guys. There is a time and place where you definitely need to utilize our services from our law enforcement because they're going to keep you safe. Don't ever put yourself in a situation you shouldn't put yourself into. Never confront a person in crisis. That's what the MCOT team is for. That's what the law enforcement is for, to get those people out there that can actually de-escalate that situation and make sure everyone is safe. And you don't want to engage people that are doing illegal activities. Don't walk up to somebody and be like, I just saw you sell some drugs, blah, blah, blah. Don't do that. Call law enforcement. Let them handle that situation. It goes back to public safety again and the safety of the citizens. And never startle a person that is mentally ill. Don't walk up and wake someone up and shake them, grab their shoulder. People that are mentally ill are not, they're not more dangerous, but they are unpredictable. So we want to not do things that are going to put them and you at risk. That's when you call us and let us engage. And that is the end of my presentation. Here's our contact information for anyone that wants to get it. And if there's more questions now, Captain Scott's here with us and we can go ahead and go through the rest of those questions. I think we have about 14 minutes left, right?
Yes, the session ends at 2:20. Oh, 12:20, I'm sorry. I gave you an extra couple of hours there. We do have a few more questions. I'll just start at the top. The first one is, have arrest rates dropped within the homeless community after implementing this program?
Have arrest rates dropped since then?
So repeated arrest rates and recidivism has dropped. We track homeless contacts, and our homeless contacts have accelerated since the start of the program. And that's what we anticipated, was an increased contact. So what we have is the arrest rates stay about the same, but our contact rate has increased exponentially. So you would expect arrests would increase with contact, but that didn't happen. So to simply answer your question, we have a couple dynamics on our statistics, and our contacts have increased, but arrests have not. So the answer to the question would be just simply no, they have not increased.
Thank you. The next question we have in the queue is, I am wondering if Anna and her team would be opposed to other agencies using their self-success commitment form as a skeleton to create a similar form that would fit other agencies' programs. I believe that a form similar to this one would be very beneficial for my clients, and I would love to use this idea as well.
Yeah, just reach out to me. I'd be more than willing to share it.
The next one is, are you sharing this with other local PDs? I believe this was in reference to de-escalation training. Brooke, if you'd like, you can raise your hand and elaborate more if you would like.
So I'm not sure. I think you need to read that again, Lynn. I didn't quite understand that one.
So the question is, are you sharing this with other local PDs?
And are you talking about the crisis intervention training is for all law enforcement? If you're talking about our training that I personally put together, we've only done it with Ogden City right now, but that would be subject to discussion with the administration.
Yes, I'm not totally sure. Let's move on to the next one. The next question is, what you're saying makes me think of a book titled, oh, sorry, skipping one. Okay, the next one after that is, so is everyone who is working with the homeless community trauma informed first?
I couldn't answer that honestly for anyone else. My personal approach is trauma informed. I would say most of them are, but you would have to reach out to those specific agencies and ask them if they're going off a trauma informed model.
Great. The next one is, did you receive apprehension from those experiencing homelessness with this program? What were some general challenges?
The general challenges are building the relationship and the trust, you know, and the rapport and following through. Like follow through with this group of individuals is huge. You have to prove to them that you're really going to do what you say you're going to do to build that trust and rapport. But we went from them initially, you know, show up in a cop car, everybody would scatter, and now they come to the police car. So it was just that continued relationship and rapport building. And that's really the only resistance. I mean, we have people that walk up to the police car and ask the officers now, will you run me and see if I have warrants? I need to know what I need to do. So the whole dynamic has changed, but you know, we're 2 years into the program, a year full-time. And then, you know, that first 6 months was building all of the foundation and the macro level within the department.
Really quick with that, one thing I do want to point out is with the pathways that Hannah has opened up and with, you know, this relationship she's been helping people build with law enforcement, with me being so new, it's been very easy for me to start building rapport with these clients. They're not resistant. They've been more than welcoming with the new girl coming in, and it's been fantastic. I think they understand that we see this as people just doing peoply things, and seeing them as people has made a huge difference with, you know, the relationship. Anna's been fantastic. She has just definitely rocked this program that she has made. It's made it a lot easier as a second advocate.
Well, and even to touch on like Captain Scott sitting here like yesterday with going to buy the individual the shoes. I mean, this individual came to the police department homeless, had been recently released from incarceration, and he slept somewhere. And when he woke up, all of his things were stolen, including his shoes. And Captain Scott going and buying him shoes and building that relationship. Like he even called me today already and was like, I want to thank you guys again, because it changed the dynamic of just the conversation that happened while we were gone picking up shoes, the relationship he was able to build with Nancy and Officer Whitby. You know, they sat and talked with him the whole time we were gone. And then there was a citizen that came involved. So like, I'm a firm believer in the universe hands you what you need right when you need it. And just that whole situation yesterday built rapport that'll continue to grow, because this individual is not someone new to me. And the last contact we had was not the same. So knowing that the previous contact with him was adversarial and he still walked into the police department and asked us for help is huge.
And I would like to add to that by saying, you know, we're painting a rosy picture here, but we're not done. We're not 100%. We would like to improve when it comes to customer service, police department wide, our program. So we're still a small scale program. We'd like to build on the program. And can we improve when it comes to customer service and our relations with the homeless? Absolutely. So we're not where we need to be, we definitely need to improve, and we know where we need to improve. So,
but we're all working on it together.
Thank you. We have 2 more questions left in the queue. The first one is, have you worked with other cities or counties to encourage or educate them in implementing similar programs?
Not county specific, but I've been working with Melissa Freegang from the Center of Excellence, which is Weaver County. And she has been working on integrating at the county level a program similar to this. And so that's all I can say about that part. I don't know if you guys on the admin level have talked to other cities related to this program.
you know, this program has gotten some attention, statewide attention, countywide attention, and we have brought agencies in to look at the program, but I don't know of anyone that has tried to adopt or replicate the program so far.
Thank you. And the last question we have in our queue is, do you think officers have changed the way they interact with the homeless community, even when the advocates are not with them?
Yes, I do. I definitely do. I've actually seen that. All I can say is, yes, I know that the interaction has changed. I have like Kirshner, who will go out in the mornings and he'll bring in a whole list and like, Anna, I talked to this person and this person and this person, and this person needed a bus pass and this person needed this, and this was a new contact, and here's their information, and can you find them? They'll be at this location. And Passig does the same thing. Bishop does. So I'm talking specific about community policing guys right now, but we've had traffic officers bring me like the lady I talked about in the video where that came through traffic. I've had patrol refer people over to me. So they're doing engagement and talking to the people and trying to figure out the balance and how can they help. And then also, like he said, we still have to have enforcement. We have to find the way to do that. And I think there's many officers that are doing a really good job at that.
Thank you. That was the last of our questions, just from on my standpoint. Thank you so much for what you do as well. And we really do have several people who've shared similar accolades in the Q&A if you had the moment to look at it. We have about 8 minutes left, so if anybody would like to raise their hand and ask another question or put it in the Q&A, we'd be happy to share it with that. But if not, I'll give it a few minutes and then we can end the session.
Okay, thank you, Lynn.
Okay, we aren't getting any other questions or raised hands, so I'm going to go ahead and end this session today unless you guys would like to add anything else.
I just want to thank all of the community members that work with us. I don't know who all is on this presentation right now, but I really value the work that we do together. And I know that this program wouldn't be where it is today if I didn't have their support and them working hand in hand with us and helping us build these processes together. So this program works because it's all of us together. It works because we have the strength and the support from law enforcement to see things differently, and the community members to come to the table and help us create these processes. So this is a whole coordinated effort, and it's not possible without everybody involved. So thank you to everyone watching and everyone that's a part of this program with me in those nonprofits and those helping agencies. I thank you guys a ton.
Thank you. We'll close the session and we'll see you after lunch for, actually no, what time the next one starts at 1:20. Thank you.